Welcome, everyone. I'm Claire Baker. I'm Director of Communications, Senior Director of Communications at Beyond Celiac. Don't want to lose any words in my title. I'm here today with Erica Dermer and Amy Ratner. Erica Dermer is probably best known as the Chief Celiac in Charge at Celiac and the Beast. She also works with I'm Aware at-home health testing. I'm Aware is also a partner of Beyond Celiac, so just want to note that they do a celiac blood panel test for at-home use, and we think it's a great tool for driving diagnosis. So we're happy to have that connection as well. Erica was diagnosed with celiac disease in 2009 and has been a vocal advocate and proponent for our community probably since the day you were diagnosed.
Yeah.
Amy Ratner is our Director of Scientific Affairs here at Beyond Celiac. She's been part of our team for 5 years, 6 years, a while. And then before that, she was a writer, and I won't name the magazine because I always goof up the name, because there were 3 that had kind of identical names, and now there's 1. And anyway, Amy was part of the gluten-free and celiac disease space before Beyond Celiac, and really many years ago when her daughter was diagnosed as a baby with celiac disease. So Amy has been, how long have you been in the celiac disease world, Amy?
Since 1992. My daughter was 2 and she's about to turn 31.
So that's a long history. Today we're talking about the changes that have come to pass in celiac disease and managing celiac disease, which is, right now still the gluten-free diet. So we're going to talk about past, present, and future. Amy and Erica, did I miss anything in your introductions? Anything you want to add?
No, I'll just add, I'm so thrilled to be with this nice group of people, both the ones you see and the ones that are joining us to have this conversation today. Erica and I used to bump into each other a lot at conferences and events, and obviously that has not been happening, but we look forward to the day where Erica can lend me plugs and wow me with her very fast ability to tweet live. So
yeah, we both worked for Gluten-Free magazines, so we have known each other for a very long time, and Amy is just an incredible person and so knowledgeable, and I'm so happy she's with Beyond Celiac now, and it just warms my heart to be with her. And so hopefully we will eventually be in live events together, because that's really where we both shine, is deep down in the research and talking to doctors and getting all the nerdy stuff done.
Well, and there's an equal commitment, I think, for everybody on this screen to evidence-based research, and really the information that we share is we have that underpinning of wanting to make sure it's actual solid science and that we can
absolutely.
So well, and we had worked together, we colluded before the beginning to talk about what the big changes in the community have been. And I'm not sure these are in any specific order, but we're all looking at the same list, or were anyway. And so just to kick us off, or any opening thoughts do you think about the biggest changes, and then we can kind of dive into the specifics that we came up with.
I think for me, I always like to tell people when I'm giving presentations live is every year that we have is the best time to be living with celiac disease. So I said that back, 5 years ago, and I was giving presentations, and I'll say that now. Right now is the best time to be living with celiac disease. The advances that we've made so far, every day feels like we're just making so many more advances, and things are getting better and better. So I just like to kick it off with some positivity, because sometimes that's hard to find in our community, but truly we have been making huge strides. So excited to kind of chat a little bit more about the specifics.
How about you, Amy?
And I think for me, what I look at as the biggest change is sort of my very real belief that there will be additional options for people who have celiac disease going forward. And of course, it has a really personal implication for me, because my daughter is still young, she now has a child, celiac disease is genetic. And so I think the biggest change for me is this real honest feeling that we're going to see something more actually happen. We kind of tease the doctors that they 5 years ago, 10 years ago said 5 years, 5 years ago said 5 years. And I really feel that like the ground has shifted on that and that something's really going to happen.
I have celiac disease too. I forgot to mention that I got diagnosed in 2010. So I've got 11 years under my belt of seeing the community. And even in 2010, when I got diagnosed, I heard the stories of it is so much better now than it used to be. And so let's talk, I'm going a little off script here, but let's talk a little bit about the change in food, both the quality and availability. That's a big one, I think. Do you have, go ahead.
Yeah, since I can really go back in history really far, I guess I can start. And anyone who's ever heard me talk about it knows that I would talk about how when my daughter was diagnosed, we would order her bread from Canada. And by the time it got here, it was often moldy. We didn't have any gluten-free label on pretty much anything. And so we lived with this memorized list of ingredients that we thought were safe or that were questionable or that were clearly unsafe. And I was just telling Claire the other day that I can clearly remember when I used to order for $10 this stapled page of mainstream products that people had called on the phone and all of that. Not a single one of them were labeled gluten-free that were thought to be gluten-free. And I would, it was just mimeographed copies. I'm really dating myself now, mimeographed. It was just copy pages. Yeah, God, I don't have a cane yet. Up in the corner, it was stapled and I would take it everywhere. So to be able to, and the other thing I remember is if a company would make a product and tell you on the phone was gluten-free, there was like this, great celebration. There was this thing called Ken My Rice Bran. That was a cereal that everyone loved and people were buying it and talking about it and eating it. And then all of a sudden Kellogg's decided no more Ken My Rice Bran. So then you had to run to the store and buy every single box you could find. So you had a supply because when that ran out, that was it. So the changes in food are just absolutely myriad. And I can't even describe for you. I'm trying to think of an analogy that would describe how different it is. And while Erica talks, maybe one will she'll inspire some brilliant analogy for me. But the change in food is just incomprehensible if you go back as far as I go. And there are people that go back even further than me who, remember the banana diet and when that, basically all they ate were bananas. So anyway, I'll let Erica pick up from here.
Yeah, I mean, I worked with someone who was diagnosed when they were a kid in the early 50s. And again, banana babies. If you don't know the story about celiac disease and banana babies, it's definitely something to Google one night when you're just like, I would like to be shocked and awed. Like it's definitely better than anything you'll see on TMZ because it is just bonkers, that whole story. So from that time, we then progressed, obviously, mail order, like Amy was talking about. And, I have another friend, Erin, who also remembers that time where everything was also mail order. You can't just walk into a grocery store. And besides like fruit and vegetables, if you wanted bread, you had to specialty order it. And now we have gluten-free mall, and every brand has something that's gluten-free, that's certified or tested. And now you can get it via Amazon, literally the same day for Amazon Prime. We also have gluten-free microwave dinners. I mean, I grew up on Kid Cuisine. I don't know if anyone else in the 80s remembers Kid Cuisine, but it had like a full meal and I'm like, oh man, microwave dinners are the best. And then when I was diagnosed, I'm like, oh, I wonder if I'll ever have that again. And now I can go to any Whole Foods or even Trader Joe's and get a microwave meal. Not saying that they're the most nutritional value that you can ever get, but again, convenience is the biggest thing. Like I can order something on Amazon and the next day it'll come to my door. So convenience is huge. Another one is grocery stores. You know, I just posted a picture on Instagram and it had like almost 2,000 likes. And the reason is because people identified with it. It's a picture of a storefront, Central Market in Austin, Texas. I love it. But it's a storefront picture and it just has all gluten-free products and it's 3 freezer doors. And people are like, this is incredible. It's just like a regular grocery store that's down the street in Austin. And it's in America. It's not in like Finland or anything where the diagnosis rates were huge or something. You know, this is in the US and you can go to a grocery store and pick up frozen food and it's incredible. So that's incredible. Another one is college dining halls. I was just at a teen summit and people were talking about going to colleges and talking to the disability offices and talking to like dining hall staff. And there are colleges with top 8 free or gluten-free dining halls. Like that's mind blowing to me because when I went to college, like we had dining halls that were basically, it was part of the meal plan that you had to get when you were living on campus. And it was just like a smorgasbord of gross food and it was food. But if I think about like being diagnosed now, like teens these days are just like, oh yeah, I know where I'm going to college because they have a gluten-free dining hall. And I'm like, I had no idea. And it's incredible the amount of colleges and universities who have gone over the top in trying to make, you know, food allergy friendly dining halls and really working with their disability offices. And that's something that we haven't seen until really the past probably 5 to 10 years. And that's a huge, huge thing because people shouldn't have to be afraid of getting higher education just because they can't eat, or they're afraid to like live on campus because they think that they have to like live at home again because that's the only safe space. Like you really can do whatever you want to do, from travel to college to getting microwave meals. And that's changed completely lately.
And I'm gonna give props to the community. I think because our community advocated for it and really pushed in the right ways, we got some guidance. We finally got FDA labeling policies standardized. It only went into effect in 2014, and that wasn't very long ago. And so before that, you know, it was kind of the Wild West in gluten-free labeling. The fad diet was taking off. You know, I remember buying romaine lettuce labeled gluten-free. It is, but you know, it's like bottled water labeled gluten-free. You know, people were really capitalizing on the marketing dollar there, but it wasn't until 2014 when you could really truly begin to trust that gluten-free, unless it was certified. You know, certification was happening before, but the labeling, anybody could say gluten-free before that, and there wasn't actual, you know, they didn't actually have to do anything to back that up. Now, if you see gluten-free on the label, certified gives you much more confidence, I think. If you see gluten-free on a label, that company needs to be in compliance with the FDA rule. And so if we hadn't advocated for that, we in the community hadn't advocated for that, we might still be, you know, playing gluten roulette every time we went to the store. And I think, you know, the Alice, or the CEO of Beyond Celiac, worked tirelessly in the early days of this organization. You know, she camped out at Walmart to get, you know, it's one thing for Whole Foods to carry gluten-free options, but it's another thing to make sure that gluten-free is available to everyone. And there are Walmarts everywhere. I remember in 2012, I went to visit my brother in Roswell, New Mexico. And I thought, I'm going to be in trouble. This is going to be hard. And then I went to Walmart and there was a whole shelf and I went, oh, thanks, boss. I didn't work for Beyond Celiac then. It was like, thanks, Alice. I don't know you, but I think I owe you a big debt of gratitude on that.
The other sort of part of this too is that the taste, the availability, the variety have all just been improving incrementally. But one of the things that has also been impacted is the cost. You know, when my daughter was diagnosed, you would easily spend $6 for 8 ounces of pasta. And now, you know, I can go into my local Giant where the store brand, it's not the Giant brand, it's whatever their organic, natural foods, maybe not organic, but natural foods brand is, it's escaping me right now. I can buy their pasta. Sometimes it'll be on sale. and you can get a box for 99 cents, $1.99. And then of course there's Aldi, which, discounts even lower. So, all of that activism by people in the community in pushing for the labeling laws, these are all things that are a result of it. In the years when that was in process, it was a complicated, drawn out, often neglected by the FDA process. And it was only because people got together and organizations took on the cause that the FDA was finally forced to come up with a definition of gluten-free. The actual food allergen labeling law was passed in 2004. And they had a deadline for defining gluten-free, and they just it went by. So I agree that it was the community saying, we need this, we want this, we'll push for this, that got that straightened out. And it was sort of mind-boggling to think that before that there was no definition for gluten-free. And you're like, well, what does that even mean? What do you mean there's no definition for gluten-free? But that was actually the case. And it's also why you never saw a gluten-free label on a mainstream product. Obviously, if you were going to buy a specialty bread mix, let's say, from a specialty gluten-free company, and there are many of them, many of which were started by people, by the way, who had celiac disease themselves, they would say this is a gluten-free sandwich bread mix or whatever. But the mainstream companies were not touching the words gluten-free on a label because there was no definition behind it. And so once that definition was finally accepted and approved and wended its way through the process, that freed the mainstream food companies to use it. And, make no mistake, they were doing it because, yes, and because it was beneficial, yes, to people with celiac disease who could be their customers. But on top of that, it was beneficial to people who identify themselves as perhaps gluten intolerant. And later on, we might talk about the pluses and minuses of that development in the celiac disease world, which, let me tell you, in 1992, you would have never foreseen that would ever happen, ever.
So a couple of comments in the chat. Family Star is newly diagnosed and notes the challenges of trying to navigate it, both the food part, but also just how strict do you need to be to keep yourself safe, both in the kitchen and with your cosmetics and that sort of thing. Concern about the nutritional, the deficiencies, frankly, in the gluten-free diet, because a lot of the regular gluten foods are enriched and the gluten-free ones usually are not. And also the note that medications and supplements, that's still an area that needs some clarity and improvement for our community to be safe. So I just want to acknowledge those are coming in, and there's still work to be done. So it's not like we're done, yay, let's celebrate.
Absolutely. Yeah, and I mean, supplements are obviously the wild, wild west for everything. It's not just gluten. There's a lot of supplements out there that are not really the supplements that they claim that they are, and it's regulated in a totally different way. So always be cognizant about that. OTC medication and prescription medication, like we're working on that. There's bills in legislation. And while they're maybe not top priority because it's so rare to actually get something that could be contaminated, I think that it is important that we know that something is working in the background. And I think the biggest thing for newbies is they come in and they're like, well, why isn't this done? And why isn't this done? And why isn't prescription and OTC and shampoos and blah, 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 blah. Well, there is research going on in the background. And that's the biggest thing I tell people. Like, it's not like people are sitting on their laurels, resting on their laurels and just like hanging out and saying, hey, things are done for the gluten-free community. There are people in the background working tirelessly to pass this legislation, to work with labeling, to help enrich this food. There are dietitians on these major brands that are helping to fortify foods or to find better ingredients to make sure that gluten-free food isn't just full of fat and full of sugar, because that's how they made things better tasting without the gluten. So there are things working in the background. And I think that we as celiacs can be very impatient because we're like, we need to make this happen. But as we saw with the FDA ruling for what gluten-free actually is, sometimes it takes years and years and years. So we are working in the background, and there's so many of us dedicating our lives to making the next generation for gluten-free people and celiac disease people have a better and easier life than what we had. I mean, especially us on the panel here, like we're working tirelessly for this, but I want you to know that those things are being worked on in the background, and we just need to continue to fight for our legislation and work with nonprofits like Beyond Celiac to keep this happening. So it's not like it happened by accident. All this is just years and years and years of all of us working in the background for it.
One
So
thing I might note
Go ahead, Amy.
about, sorry, Claire, I might note about the nutritional value of gluten-free food. Back in the old days, all of the pasta, the bread, any of the those kind of products that you think about, they were all made with rice flour, predominantly rice flour. And if you ever would look at the nutritional panel for rice flour, it's basically nutritionally devoid. Like it has no nutritional value. In a certain way, yes, you could get a pasta, and when you were making spaghetti for your family, this $6 nutritionally devoid box of pasta that you only fed to the person with celiac disease could fill them up, but it didn't do anything. But another development that I think has been very positive, and it can be helpful to keep this in mind when you're shopping, is that food makers started to incorporate more and more whole grains into gluten-free foods. And so, pastas are made from a variety of grains and a variety of beans, and some of it's a taste thing, like, I don't know, I look at a thing and it's made out of the pasta's black. I'm not going there. But so it's a personal preference kind of thing too. But there are many different kinds of ingredients going into gluten-free food now that do up the nutritional value. And when you're shopping and choosing, you can look at that nutritional panel, and that can help you decide how you can make your diet healthier.
I think that I agree. I'm okay with black pasta if it's made out of black. I like the edamame a little better, but Emmy brings up a good point in the chat that easier to eat at home because the products are out there, but restaurant dining is a challenge, and part of that is the rise of the gluten-free fad diet and how some restaurants have handled that, and how others, they're not all gluten-free offerings at restaurants are created equal. Talk a little bit about that. And then I think it eases pretty well into the conversation about overall challenges that we've discovered with the gluten-free diet in general.
Yeah, so I can tackle, the fad. I deal with this a lot. Obviously, I travel a lot for work, or I used to before everything happened. And, I would always go to restaurants, and I think that we all learn as we go through our life with celiac disease that not all restaurants are created equally. And while some people choose to only eat at dedicated gluten-free restaurants, first, let's acknowledge the fact that it's incredible that cities across this country have dedicated gluten-free restaurants, dedicated gluten-free bakeries, dedicated gluten-free breweries. To be able to pull up a seat at the bar and know that every beer that they're serving is gluten-free is a feat in and of itself. This is just incredible. But over the years, I found that too many people are contributing to the idea of a fad diet. And maybe they saw celebrities, 5-10 years ago that were doing it for weight loss. There's still some celebrities that are out there that claim an intolerance to gluten, and maybe they have it, maybe they have celiac disease, because we never really know with celebrities. They tend to not divulge those things. But a lot of people are using it as some sort of weight issue. They're trying to lose weight, they're trying to maintain weight. They have this belief that a gluten-free diet is somewhat healthier, which, if you've looked at nutritional panels, we know that it's oftenly more calorically dense. A donut is still a donut, a piece of bread is still a piece of bread, carbs are still carbs. So one restaurant may not equal the same safety as others. I think they understand, if you go in and say that you have an allergy, which is the easiest server term to use, I think they get it, but some people may not understand what's actually happening in the back of the house and how important it is to use clean utensils and not boil the pasta in the same water as the other pasta. A lot of people don't know about the cross contact issues that you may be having in the back of the house, or maybe the server didn't communicate to the back of the house how important it was. I used to go to Denver every year and train chefs and servers and food service workers and talk about the importance of a gluten-free diet and what it actually means and what a crumb can do to someone with celiac disease. And, you know, they didn't know, they had no idea. They maybe understood what a peanut allergy was, but they still don't necessarily understand what a crumb can do to someone with celiac disease. So not all restaurants are created equal, and it's all about kind of asking questions, feeling out the safety, and also being able to take some risk. I think one of the biggest issues I see with people who are newly diagnosed are they're hyper vigilant, which means that they are like afraid of everything. And that's not the way to live your life. We understand that, like, if you get gluten every whatever randomly, you're not cheating. This is just like cross contact. You're not going to have long-term intestinal damage. So you have to understand and balance, like, do I feel safe here with a certain amount of risk and being hyper vigilant and never leaving your home because you're petrified of eating outside the house? And I think we have to find that balance between safe restaurants and not being too concerned to where you never want to leave your house, because we don't want to live that life, especially now when we have so many options. Like, I hate to see people who are terrified of traveling or even like eating outside their own home. I met people who refuse to eat anything that isn't made outside their own home. And for me, that's not the life I want to live. I want to still be able to do everything that everyone else does. So for me, it's about that balance between hypervigilance and also what kind of restaurant you're going to, and making smart choices, not just kind of the trendy choices, but choosing restaurants that are making smart choices for celiac diners as well.
So it's interesting. Erica's giving you a perspective that she has as she took care of herself with celiac disease. In our family, we were raising my daughter, who was a toddler when she was diagnosed. And my husband and I made a decision very early on that we wanted her to live the most normal life that she could. We didn't want her to be limited by this diagnosis of celiac disease, which in her presented as what they call celiac crisis. So she was incredibly sick before she was diagnosed. Probably, I mean, it'll sound dramatic. And if she's listening, sorry. It's, you know, she was almost really knocking on death's door. That's how sick she was. But she was very lucky in that she was diagnosed fairly quickly, within about a month and a half, and recovered beautifully on the gluten-free diet. But then we had to juggle, okay, what do we do now? In this era where there was not a lot of gluten-free stuff out there, certainly no restaurant with a gluten-free menu, absolutely no such thing. But we made a decision that her life was going to be as normal as we could make it. And so we did take her to restaurants, and we had, you know, a sort of coping system. She ate a lot of plain chicken, and we did a lot of explaining of stuff to servers who, when we would say, you know, it has to be gluten-free, they'd be like, oh, glucose. Oh, that's like sugar, right? No. Oh, okay. So we did revert to that. I'm allergic to, even though we knew it was not an allergy. So she ate a lot of plain chicken. She ate a lot of baked potatoes. She ate a lot of plain salad. We sent back salads with croutons with regularity. But we felt that her having the exposure and the normality of that in her life was very important. And that's kind of how she grew up. She went to the college she wanted to go to. She was lucky in that they didn't have so she graduated, she's 31, so she graduated a while ago, but the college she went to did not have one of these large scale food services, which can be hard to work with. Although they've gotten better too, I have to admit, they've gotten better. But their dining halls were run by that particular campus. And so we talked to the nutritionist, we talked to the dietitian, everything, you know, things were worked out. Yes, she ate a lot of chicken, she ate a lot of rice, but she was okay. She was healthy. She graduated. She studied abroad in London. I remember the only time I ever thought about restricting her because of her diet was when she was going to London. And the college said to us, well, normally our exchange students, I'll call them that, live with each other in the dorm. But in her situation, because of her diet, maybe we'll put her in with graduate students in an apartment. And honestly, for 1 nanosecond, I was like, okay, yeah, she's going to be across an ocean. Maybe this is the thing to do. And then I don't know if it was her or my husband or all three of us, we were like, no, wait, that's not right. This is counter to everything that we've had in mind. So P.S. she lived in the dorm. There was a great chef there. He taught her how to make omelets. They treated her really well. So I guess this is a very long way to say that you make your choices to balance your risk and the normality of your life. Some people, that's more limited because of the way they react. And the reality is, if you get sick all the time, it's going to have an effect on what you're willing to do. But within the parameters of what your disease looks like, you have to balance that normal life with the way you live that life. I almost hesitate to call it risk, because then people interpret that like, oh, they're out there taking risks. You shouldn't take, that's not what I mean. I mean, you balance how you want to live your life with the way that you can live your life the most normally in all kinds of ways. So that's the way we guided her raising, and it seemed to work out for her.
Yeah. And I think the word risk, I mean, every day you wake up and you get in a car and you drive to the grocery store, that's a risk. So I think we understand, especially now with COVID, maybe we understand risk and reward better, like risking going outside your home. But when you do, take precautions, right? So when you drive a car, you wear a seatbelt. When you go outside during COVID, you have a vaccine and you wear a mask. Like, these are the things that you do for risk versus reward. So there are people who are afraid to only eat at dedicated gluten-free restaurants, and that's fine. But I will tell you, there could be a reward if you go farther in your risk factors and maybe work with restaurants that are corporate trained to deal with celiac disease. Red Robin is one, P.F. Chang's. I know a lot of people will have their thoughts on whatever these restaurants are for safety, but like, there are restaurants out there that have corporate food safety training. They have different dishes that are for gluten-free diners. They're doing it right. They're not catering to those who want to eat it just for low carb or fat or whatever they do. They're really going out there because they want your money. Like, we are 1 in 100 people. Restaurants want your money. So they're going to take time and investment into their infrastructure to make it safe for those with celiac disease, or hire chefs to do training. So again, it is risk. But we take that risk every day we leave our homes, or we wake up every day, or we eat food prepared by somebody else for listeria or salmonella. Like, there's certain risk factors just in daily life. So I want people to realize that, like, they can maybe take an additional risk, or like explore outside their comfort zone, because it's very easy to just like never want to eat food that's made not outside your house. And I want people to be able to live a full life, like Amy said, like, do whatever normal people do, because we're normal. We just happen to have a different diet. So I want to make sure that that's always first and foremost. Like, yes, you take a risk, but we also take a risk every time we leave our own home. And we all don't want to be like hermits that don't leave our homes. We have to live our lives. So I think that that's a perspective that I always like to go into, because a lot of people are terrified when they get diagnosed. And while, that gets easier over time, like, just know, between me and Amy's story, like, we can live normal lives. This is what we can do now in 2021,
Erica, you get pretty sick when you get gluten, right? And you have more than gluten is an issue for you. Is that true?
Yeah. So I'm gluten-free, dairy-free, beef-free, oh my God, egg-free. I don't know. I've got some other things. I have low FODMAP for a lot of things. And I had a paralyzed stomach when I was first diagnosed. Like, it really affects extraintestinal manifestations. And we can talk about that as well. Like, things that are outside the digestive tract, or like symptomatic, like what you think of as classical symptoms. So I do. And I take that risk because I want to live a normal life. And I think that that's a perspective that a lot of people should think about, because we can't just, be afraid of our symptoms. Like, we want to obviously be as safe as we can, but we want to also live a life. So
I'll jump in here. One thing we had talked about prior to the call was how the internet and social media has kind of changed the landscape, both for people with celiac disease, but also information about the gluten-free diet. And one thing we know from our social media following at Beyond Celiac is that the variability of symptoms when getting gluten is huge, and that the more we can have compassion for each other, some people will say, I can't believe that you would act in that way. I get so sick. And other people would say, I can't believe you would act in that way. It's not that big a deal. And the answer isn't your experience is everyone's experience. It's, so having that compassion for understanding where people are in time duration. I was probably more worried when I was early diagnosed, because there's just so much gluten in everything. And then once you get kind of good at it, it eases up. But I definitely get glutened more now. It's true. I never intentionally consume gluten, but I make more mistakes now because I'm not as vigilant as I was before. And I get really sick now. It's not fun. It's bad. I should be, there have been times when I went, like once on my vacation last week, I thought I glutened myself, and thank heavens I hadn't. I went back and read the package, and it was a false alarm. You didn't eat gluten. But there for about half an hour, I was like, we're on Mayday watch here, because it takes a couple hours for all my symptoms to kick in. But I think recognize the difference in the variability in the community is part of that. Part of that too, and this is I'm shifting. Watch this segue. Increase in diagnosis rates. So when Amanda was diagnosed, celiac disease was thought to be super rare.
Yeah, I think we were told at that time that about 1 in 2,000 people had it. And then we did participate in the epidemiological study that was done by Dr. Fasano. At the time, he was at University of Maryland, which isn't far from where we live. And that helped to establish the number as being closer to 1 in 100.
And I think as more people are diagnosed or recognized as diagnosed, there are estimates now that, and when I started at Beyond Celiac, it was estimated that 3% of people with celiac disease were diagnosed. And now Joe Murray and others will say up to 50% are diagnosed. So that with more people being diagnosed, we have a bigger pool of potential level of symptoms when getting gluten. And so those are shifting sands. And organizations like I'm Aware, that has the at-home testing kit, are kind of helping us be empowered patients. Erica, I didn't plan on teeing you up that way, but
yeah, so when I started, I had series of misdiagnosis after misdiagnosis, and finally celiac was the answer. And I didn't know much about it. None of my relatives have heard anything about it. And when I was diagnosed, I kind of went all in. Obviously, I was like, I'm going to write a book. I'm going to do all the things that I didn't hear about when I first got diagnosed. I started relationships with the major nonprofits, including Beyond Celiac. Like, I wanted to be all in because I didn't want anyone to have the experiences that I had when I first got diagnosed, where it's basically like, here's a list, and then maybe Google it. I don't know, find your people. And now it's super easy. I've got a Facebook group, like literally people can talk to me, ask me questions all day long. Beyond Celiac is an incredible resource, but I still had problems diagnosing or getting my first degree relative screen for celiac disease. I think this is the biggest issue today, is now we can get people diagnosed for celiac, but there is no first degree relative screening. Like, people are like, oh yeah, maybe tell your mom, your dad, your sister, whatever, but no one's really like, all right, let's get everyone in, the first degree relatives, symptoms or not, let's get them in to be screened. And that absolutely has to happen. You're probably not the only one genetically, because it's a genetic disease, right? That comes from your mom or your dad. There's a mix of genes that can cause celiac disease. And yes, you do need to have environmental triggers, but wouldn't you want to know if you're apt to have a disease, or if maybe the symptoms that you're having are because of a disease? So what I do now is I work with a company called I'm Aware, and I was a beta tester for them with you guys in 2018. They were doing at-home screening. And I'm like, great answer. My mother is trying to get screened for celiac disease. And because she doesn't have symptoms, and because her doctor doesn't understand the need for first degree relatives to be diagnosed, he kept saying no. That is insane to me that a doctor's like, no, you can't have a simple blood screen. Insurance won't cover it because you don't have symptoms, or I don't think it's necessary. And so she's like, what do? I can't fight with my doctor. I'm like, first of all, yes, you can, or maybe find a different doctor, but she's old school. She doesn't want to do that. She doesn't want a doctor shop. So I told her, I'm like, listen, like, I'll bring you into this beta test. Let's get you screened with a company called I'm Aware. They do the same screening that major universities do for celiac disease. And let's just even see if you have elevated biomarkers. And she doesn't, thankfully, but like, it's so easy. And that's why I decided to join I'm Aware. Is I'm like, let's make it as easy as possible for people to be screened for celiac disease. You know, until we have mass screenings where infants are screened at birth for genes or for celiac screening, which probably won't happen for a very long time, although I will continue to fight for mass screening. You know, this is a simple and easy way for under $100 to get your family, first degree family members screened when you're diagnosed. So it was great that my day job can align with my passion for getting people screened for celiac disease and increase diagnosis rates, but I will always fight for getting people screened, having people do a biopsy, you know, getting the gold standard diagnosis, because it's so important to know. There's so many long-term issues that are related to celiac disease, especially like osteoporosis in women, additional autoimmune diseases, which I have a lot of them. So to know that they're all connected and it's all due to like my autoimmune disease, I want other people to have that freedom of being diagnosed and know what to look for and really take charge of their own health journey. Because if I didn't, I would have just been sitting and being miserable. Like, I had to own my own diagnosis and be in charge of my own health journey. And unfortunately, while diagnosis rates are increasing, we're not still there yet. There are so many undiagnosed celiacs still that are just living with these symptoms that they're like, oh, I guess it's okay for me to have diarrhea every day, all day long. And you're like, that's not how you're supposed to live life. And maybe they don't understand that their life could be so much better if they were just screened and on a gluten-free diet. So something that I'm obviously super passionate about, because it's not there yet, and we need to continue to fight for it.
I think
So
Erica had mentioned that there's a lot of things going on behind the scenes. And one of the things that is going on behind the scenes is that there are researchers who are trying to provide the U.S. Preventative Services Task Force, or whatever it is, with the evidence that it needs in order to endorse widespread screening. Because the last time they looked at this, they didn't say it was needed or not needed. What they said was there's not enough evidence to make mass screening something that happens in this country. So as we've seen research just explode in all different areas of celiac disease, that's one of them. And I was telling Claire that since I like to look at factual stuff, I went to look at a PubMed, which is a place where they, it's sort of like a repository of all the studies that were done. And so I was curious about the sense that I have that we're talking about why the gluten-free diet is not enough, which is a real reversal of the days when I first came to know celiac disease, when we were told by all the experts, when we all absolutely believed that if you were on the gluten-free diet, you were as normal as the next guy in every way that you could be looked at. Which is, I think, why people started to normalize their symptoms as well. They were like, well, I have celiac disease. I'm on the gluten-free diet. I should be fine. I guess this is what fine looks like. I don't know. But anyway, in 1990, around 1990, when my daughter was diagnosed, in the entire world, under the records kept by PubMed, there were 266 studies of celiac disease. It had stayed that way, hovering around 250 roughly studies a year from 1969 until 1994. And then suddenly it started to go up. And I think the reason it started to go up is researchers around the world had some interest in the subject. And when they started to look at people with celiac disease, they realized, no, they're not A-OK on the gluten-free diet, which is why people continue to not feel well. They continue to struggle. They continue to have symptoms, sometimes severe, that are triggered when they get a little bit of gluten. These are all things that became recognized only because the researchers in labs spread all over at celiac centers that started to become more and more established in the United States and around the world. They started to look. And so when you start to look, because you have suspicions, which is what science is like, I wonder why this. And then you do a study and you start to get an answer. So in 2011, finally, the number of studies started to go up. So in 2011, there were 1,000. The peak, if I'm looking all the way from the beginning, the 1920s forward, and this is interesting because you would not have predicted this. The peak in celiac disease studies was in 2020, believe it or not, 1,245. So think about that. That's what, 6 times as many studies as were being done for decades and decades. And that's why we know more and more and more and more about the actual disease itself. And that's why this idea that the gluten-free diet is not enough has taken hold. It's not enough because people who are asymptomatic still have damage to their intestine. It's not enough because it is limiting to your daily life, even if you're on a gluten-free diet. It's not enough because people who follow the strictest gluten-free diet they can possibly conceive of still turn out to have positive blood test results. So to me, that realization and the increase in research are absolutely linked and are better for everyone in the community. I know there are a group of people who think that, the diet returned them to health. It did with my daughter. I used to describe her when we brought her home from the hospital as like that plant on your porch that you didn't water. And it's like this. And you're like, oh man, this thing is, and you give it some water and boing, it stands right back up and that's exactly how she was. So I absolutely know the value of the gluten-free diet. And I understand that it's still an integral part. It's the only thing there is in celiac disease. And it's going to be an integral part of celiac disease for a long time because the different treatments that are being studied, and currently we have 13 of them on the drug pipeline that we maintain and we try to keep up with, and we're about to add 2 more. Initially, any treatment that's developed is going to be used in conjunction with a gluten-free diet. And then from there, researchers, I think, hope that one day they'll be able to replace the gluten-free diet, and that would then be defined as a cure. But those, the amount of research going on, that's why we know all the things we know. The other really big development over the time that I've known about celiac disease has been the discovery and use of the TTG test for diagnosis, which I looked up when it first started to be used, and it actually was starting to be used in the early 1990s. My daughter was diagnosed in 92 and it was not used. So it took a while for it to be discovered, studied, put into, practice in more celiac center kind of settings, and then to make its way into other forms of medical interaction with patients. But that was another huge development in my mind, is the establishment of that test for diagnosis.
So I want to note there. I got a comment to the panelists to note that gluten-free diet is definitely easier to manage depending on where you live in the country. And so I do want to recognize that the availability of gluten-free foods is still very limited in some areas. Yes. And that's why Beyond Celiac is so focused now on driving research for treatment options beyond the gluten-free diet.
And I do want to briefly there, just jump in. Food deserts are a very real thing, regardless of gluten-free food or not. I have worked with numerous food banks across the country. They are too few. I work with Food Equality Initiative out of Kansas City to provide gluten-free food to the Kansas City metro area, but that's one state. There needs to be gluten-free food banks and gluten-free food available at food banks across the country. And believe me, yes, there are people fighting for this. So I want you to understand that in the background, there are people fighting for food insecurity, food deserts, the lack of accessibility in certain parts of the country. So I get it. I very much understand this. And it's something that we can all do when we donate to nonprofits who have people who are out there actually working hard to combat that. And dietitians are working to combat food deserts in general. So yes, that is a huge issue that we definitely don't have time to talk about, but it is out there. And depending on where you live, you don't have accessibility to doctors, to celiac disease centers, to a Whole Foods or a Trader Joe's. You only may have access to a Walmart, and it may have food, but it may not have the most nutritious gluten-free food. So I understand that that is a thing, and that's something that we are continuing to work on. But again, it won't be solved immediately. And we understand that not everyone will have the same accessibility of someone living in like Los Angeles or Portland to someone who is living in a very small town in middle America. So I get that, I understand that, and I want people to be understanding that it's a very real issue for a large part of our country. And we may be here talking about how easy it is for us to live now in 2021, but there's still a lack of accessibility for safe food for many people. And I also want to talk about real quick, Amy just mentioned gluten-free diet isn't enough. We do know for sure, Joseph Murray was just talking to the FDA about this, that there is accidental exposure everywhere. I mean, even if we don't feel the symptoms, we still may have accidental exposure. And there is a very real portion of those with celiac disease that have refractory celiac, which is a very serious disease. So I don't want to really dive into that because people can get afraid and alarmed, like, oh my gosh, we're all going to have lymphoma. That's not true. It's still a very small percentage of people who will have refractory celiac disease, but a larger percentage will have non-responsive celiac disease. And that may mean that they're still getting gluten somewhere in their diet and their body is just very, 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 very slow to heal. And I think that when we talk about getting a gluten-free pharmaceutical, which we can talk about next, a pharmaceutical intervention, it may not be for everyone. Some people may be happy with just their gluten-free diet for controlling their symptoms, but we have to understand that there is still a significant portion of the population that is having slow to heal mucosa or a non-responsive celiac disease or even refractory celiac disease that we are working hard to create a pharmaceutical intervention. We're in phase 3 on a lot of things, and we can talk about this next, but there are exciting things happening in the gluten-free space for pharmaceuticals. And while it may not be for you, you're like, I don't know if I want to take a pill, know that there's still a significant amount of the population that may need to have a pharmaceutical intervention.
Yeah, I'll jump in there. I think that, especially as the rate of the number of people who are getting diagnosed increases, I think doctors are beginning to understand that celiac disease can happen at any point in life. And if you get diagnosed at 70, maybe you had active celiac disease for 50 years, so the damage, your healing journey is going to be different than if it were caught earlier in your journey. And not everybody with celiac disease looks like me, they're people of color, men, non-United States people. It's a worldwide thing, and it's demographically it kind of got pigeonholed as a white middle-aged woman thing, but that's not it. And so Amy, I'll turn it over to you to talk about and I'm starting to talk fast because we're running out of time.
Watching the clock.
Take a big deep breath. We got a couple of minutes. Give us kind of the high view of where things are and potential treatment options that might be coming out. Beyond Celiac's working to get us treatments toward a cure by 2030. And we're doing everything we can to push that along. So where are we now, Amy?
So researchers are approaching how to treat celiac disease. And again, at this point, it's in addition to the diet in a variety of different ways. Some drugs under study, and the one that is at stage 3, which is the furthest any drug has ever gotten, talks about tightening the loose junctions. Another drug is looking at using nanoparticles to treat celiac disease. There are a lot of different approaches. And the funny thing about them is you don't really know which one is going to be the answer. research is a funny animal. Something can be chugging along, which is what we had with something called the NextVax2, which looked like it probably held the answer. And then they ran into trouble in their clinical trial, which is what clinical trials are all about, is to test and to see if it works and to retest it and keep testing it. So, but there are, a variety of different approaches to how celiac disease might be treated. And which one of those is going to be, we get asked a lot, well, which one's going to work? Well, we don't know which one's going to work. And that's why we're following all of them. And we're also supporting researchers who are working in other areas to provide the knowledge that can help inform the clinical trials that might eventually lead to a treatment. And one of the ways we're doing that is by trying to elucidate these non-gastrointestinal symptoms that Erica was talking about. And so one of the ways that we're doing that, and we just announced this yesterday, is we're working with some researchers in the UK who are trying to answer questions about neurological symptoms. And we had previously done a story about brain fog that was just published recently. And one of the reasons we're doing this is because these non-gastrointestinal symptoms have long been ignored and neglected. To a certain degree, that's true in research. If you go into a clinical trial, they're most likely going to base the success of their treatment on your gastrointestinal symptoms, and that's because the neurological ones are harder to deal with. But they're also, and more importantly for the patient community, they're ignored in the medical setting. So if you come into a doctor and talk about these things, it's going to be really hard to find a doctor who, when you have neurological symptoms, is going to think celiac disease. So what we're trying to do with the research is get this discussion moved forward, get it on the map, back it up with evidence, ask the questions, and find out what the answers are. So that's a direction that, and an area that we're paying a lot of attention to as research moves forward. And it's exciting. It's very exciting to see what, the kind of evidence that researchers have been able to generate so far, and will look at much more in depth. The other thing that has really emerged, and to me, this is a really exciting study, it relates to the role of the microbiome in celiac disease in terms of its development and ultimately intercepting it and then preventing it. And that's being done in a really exciting study out of the Celiac Center for Research and Treatment, where they're studying a group of babies, these little babies, they say out of the mouths of babies. They're studying babies who are at risk for celiac disease to see what their microbiome looks like from basically the time they're born. And how they're doing this is with stool samples largely. So looking at a lot of stool, and they're following them because they want to see, okay, what's going on in the microbiome when that at-risk baby develops celiac disease. And we just wrote about a study where they reported on 10 children who have gone on to develop celiac disease. I think that the total number, the study was based on 10, but the total number is bigger than that. So that whole discussion of the microbiome, in addition to the discussion of the gut-brain axis, I think are really exciting things that are happening now in research.
Yeah, and I think the biggest point to mention is Claire wrote, I don't know if she wrote it to us, I don't know, Zoom. She wrote about, talk about clinical trials, huge. I always tell people to pay it forward to the next generation. So what you do now, teaching restaurants how to, teaching others how to advocate for yourself, helping restaurants understand the gluten-free diet and celiac disease, screening your first degree relatives, that helps the next generation of those with celiac disease. And I think the biggest thing that we can do right now for the next generation of celiac disease is be a part of clinical trials. And while some people aren't able to do it, like based on my symptoms, I'm not able to be a part of clinical trials. Believe me, I've applied for all of them. Some of them you do have to eat gluten, some of them you don't. But they're struggling right now to find people who want to be a part of clinical trials, but we have to have people be a part of clinical trials now so we can eventually get to a pharmaceutical intervention, or we can eventually understand the microbiome and the environmental triggers for celiac disease so we can help prevent it in the future. Like, we all have to be a part of this and the clinical trial experience now so the next generation can have better interventions, pharmaceutical or environmental, so we can prevent this from happening, or we can better understand celiac disease, because we really only delved into this in the past 50 years. I mean, we've known about celiac disease, but as far as like the microbiome, we're still getting science every day on celiac disease. So we have to pay it forward for clinical trials to be able to get the next generation to have a better intervention, a better understanding of the microbiome. I think Maria dropped something in the Zoom chat about the clinical trials happening in celiac disease. But that is always something that I will say, pay it forward. And the way to pay it forward is, donating to nonprofits so they can work for the research, but also you yourself being a part of clinical trials, or at least applying or being a part of a study. That research now will help the celiacs of the future.
There's also a very practical way that you could connect with a clinical trial. Beyond Celiac sends out emails letting people who subscribe to our newsletters, letting them know about clinical trials that are available. So if you get one of those emails, A, open it, B, click to the link, and then see if, in terms of what your celiac disease looks like, the requirements of the clinical trial, and where the clinical trial is taking place, whether you can participate. And so it can sometimes, like you hear this conversation, you're like all hepped up, like, oh yeah, I want to be in a clinical trial. Then you don't know how to do it. Well, that's an easy way, because we do a lot of outreach in that area.
And we've come to the end of our hour. Thank you both so much, and thank you all for tuning in live and writing your questions. We had questions about the gluten-free diet for other gluten-related disorders, autism, that sort of thing. We're gonna create a Q&A for that. We had a question about dermatitis or pediformis or ongoing rash. We'll add that to our Q&A. We just couldn't get to it all today. Super interesting discussion. Erica, thank you so much for joining us. Amy, thank you so much. And I'll sign off, let you get back to your day. We're going to replay this as a podcast. So if there was something you missed, you'll be able to catch it then. Thank you.
Thank you all
1
so
minute
much
before
for
we
joining
sign
me.
off.
Go ahead.
Before we sign off, let me just make a plug for our research newsfeed. Like, if you want to know what's going on in research and keep yourself really well informed, you can sign up to be on a newsletter, and we'll let you know when it's there. You can just go to our website and look under research, and we write about it all the time. Even today, we have a story about how healthcare providers still don't know a lot about this disease, which I'm sure you will all relate to.
Erica, is there anything you would like to share about what you've got going on? I should have given you the opportunity to.
Oh, no, that's fine. You can learn more of imaware.health, HEALTH, imaware.health, IMAWARE.health, and then find me at celiacandthebeast.com. It's like Beauty and the Beast, but celiac. So celiacandthebeast.com. And I'm all over the social internets and talking to Beyond Celiac. So we'll be sure to reblog each other. And I just want to say thanks again for being a part of this.
Thank you both.
Thanks, everyone.